There has, since you described the New Zealand Nurses Organisation yesterday on the AM show as having a forked tongue, a petition has emerged for your removal of health, as Health Minister. Do you stand by that comment?
What the Nurses Organisation has done, I was meeting pretty much this time last year. They came to me with four major challenges that they saw. They couldn't get their collective agreement settled. They couldn't get progress on their pay equity claim. They didn't see that the safe staffing accord was being properly fulfilled. And they wanted to see, more nurse recruitment. Some of those are somewhat related. We got the collective agreement settled in September, the reasonably significant bump in pay for nurses. We got the pay equity deal sorted in December. We got the safe staffing accord reviewed. We got a report from that in February this year.
I'm asking you to roll back, whether you're rolling back on that comment.
No, here's the point though. We did a deal on pay equity in December last year. It was all signed up to, Nurses Organisation signed it. 4 months later, after all the detailed work done to get it ready for implementation, the Nurses Organisation backed out on it. They said that they wanted to reopen negotiation on the pay rates.
Yeah, we understand the history.
I know, no, but it is important. What they've done is, I've never seen anything like it before from any union anywhere. They keep telling me, they told me last year, we need to lift nurse pay. It's important for recruitment and retention. They are blocking nurses getting a pay rise. Right now, if they follow through on what they signed up to and promised to do, nurses in our public health system today would be on base incomes of $10,000 to $12,000 a year more than what they are. The Nurses Organisation is blocking it. Then a couple of weeks ago they were saying we need to do more on nurse pay. We are doing everything we can on nurse pay. They are the impediment.
Does that comment, a comment like that, not erode any sort of trust? Why should healthcare workers trust you?
Because what the Nurses Organisation is doing is unprincipled and I've never seen anything like it from an organisation that is representing its members to improve their conditions. What they're doing is wrong. And we've got money in the bank ready to pay nurses. The massive, the significant increases in their pay, the lump sum payments that go with it, the back pay to the 7th of March next year, they are the impediment. And for them, having done that, to then complain a few weeks ago that not enough is being done on nurse pay, that is wrong. So I'm sorry that health organisations do not get off scot-free. They are open to criticism too. I am critical of their actions because that is impeding our ability in terms of recruitment and retention of nurses at this critical time.
So they say the pay equity offer wasn't backdated to December 2019 as promised. That seems to be a huge issue here.
Never promised, never agreed. And a deal was done in December last year with their most senior negotiator. Time taken to do it. That person had been involved right through the whole technical process of pay equity and the negotiations. So a deal was done. They made that deal knowing everything that had happened before. And it took them 4 months, and not that negotiator, but for others to decide, we didn't like it, we want to reopen it. It is totally against the pay equity legislation that we've got. And this is a government that amended pay equity legislation to make it easier to make a claim and to give everybody a very clear framework to operate within. The Nurses Organisation are turning their nose up at it and saying, we're just going to do our own thing. Well, no, they're not. There has to be some baseline principle to this. This is a government that is striving to lift pay and conditions in the health sector, for nurses, for home care workers, for others. We're doing everything we can. We are being blocked by one organisation representing nurses for lifting nurse pay. I'm sorry, but that's the way it is.